Ontario has started its COVID vaccinations in December with more than 220,000 doses given out so far. But there's been some criticism about the speed of the vaccinations given the surge in COVID cases across the province. Now, Premier Ford has acknowledged what he calls a quote, few bumps in the road with the vaccine rollout, but now says phase one is well underway and calls the plan a well-oiled machine, led by General Hillier, with tremendous progress being made. So, what are you seeing, Dr. Arya? What are the bumps in the road that you've seen so far?
Well, I think there's several concerns that I have. I mean, first of all, I mean, a reminder to, everyone who's watching today. I mean, it's definitely frail seniors who live in long-term care homes and retirement homes who have suffered the most and died from this virus. I mean, about 2/3 of deaths from COVID-19 have happened in long-term care facilities when we're talking about Ontario. And yet we're at a point where we're over a month into this rollout. We gave the first shots on December the 14th, and we only have about 20% of long-term care residents vaccinated. So that is absolutely atrocious. And to give you an idea, Quebec has, I think, the majority of their residents done. British Columbia is going to wrap up by the end of the month. And other jurisdictions, when we look at, I can tell you in the US, West Virginia is an example where they've already vaccinated all their long-term care home residents. The UK and Israel have actually, they're way ahead of us in terms of prioritizing high-risk populations.
What did these other jurisdictions do differently than Ontario has so far?
Yeah, so one critical flaw, and I don't have an explanation for why this happened in Ontario, was that, initially when we got the Pfizer vaccine, the Pfizer vaccine is supposed to be kept at these minus 70-degree temperatures and in these special freezers, which can only be found in like large urban hospitals or research labs. But on the product monograph, it actually says that for 5 days prior to administration, you can have it at normal refrigerator temperatures. Right. So every other jurisdiction, I mean, we can look at our neighbors in Quebec, they had it going into long-term care homes. I mean, from the very beginning, from day one, to vaccinate health workers, to vaccinate residents who undoubtedly are at the highest risk. But yet we kind of held on to it for 3 weeks in freezers. I mean, even at this point in time, the latest data actually shows that we have 75,000 doses, about a quarter of the doses actually still sitting in freezers. So that's inappropriate and unacceptable when we're having, really, a humanitarian crisis evolve in our long-term, in our long-term care sector.
Yeah, we had a lot of questions that we saw over social media or sent to us directly about why there seemed to be a break in vaccinations over the holidays. That 3 week break, 2, 3 week break. Why did that happen? What do we know about why that happened?
So I think one issue is what we just spoke about, where there was a dependence on having people go to the hospital to get vaccinated. And that's where we weren't actually seeing people living in long-term care homes getting vaccinated. It was only a very small number of health workers that could actually take out time to go to the hospital to get their vaccine. So that was issue number one. And the second was, I mean, I don't know why they did this, but they actually had a pause over the Christmas weekend. We might remember that was widely reported in the media, and General Hillier did acknowledge that that was a mistake. I mean, I don't understand why anybody would do that. I mean, this is a virus that doesn't take Christmas off. It doesn't, take nights off or evenings off. I mean, we're seeing people dying and suffering from COVID-19 24/7. I mean, long-term care we've spoken about, but the other issue to mention is that our hospital system in many areas of the province is on the verge of being overwhelmed, or frankly, already overwhelmed. Hospitals are planning these end of the world type scenarios where they're going to have to transfer patients for care hundreds of kilometers away because they won't have enough beds. ICU specialists and ethical, specialists, ethicists are sort of bringing back and are actively talking about these triage protocols where they may have to make these decisions between who gets critical care or, who gets a ventilator or not. And that's obviously something that no physician wants to ever do. So it's very important that we get this vaccine into long-term care, vaccinate as many residents and health workers as soon as possible. And then very quickly, we have to move on to other high-risk populations, including those who work in or those who live in congregate settings, shelters and correctional facilities, along with people who are seniors in the community. I wanted to really highlight that, and I'm hearing actually a lot of feedback from my own patients and in the areas that I work that people, for example, they may not be in a long-term care facility, or their parent or grandparent might not be in a long-term care facility, but they're worried. Right? They're worried about their parent who has to go out shopping or even lives at home. And we know it just takes that one little issue to get actually COVID-19. Seniors over 60 actually lead, by far in terms of deaths from COVID-19, in terms of admissions to the ICU, and in terms of hospitalizations. To give you the number, actually they account for 96% of deaths from COVID-19. So it's a reminder that, we have to make sure that we prioritize these high-risk populations and also their health workers. Right? I mean, the issue is when we talk about ventilators and we talk about critical care beds, we may have enough beds, but if we don't have enough staff to actually look after the patients, then we're going to be in big trouble. And that's something that the Critical Care Society, the Canadian Critical Care Society, has already spoken about, where it's likely not going to be a shortage of beds, but a shortage of trained staff that will have with the energy and time to do this and will be well enough.
So the Premier has described the place where we are at now as a well-oiled machine. That's not what you've described to this point. What's he talking about here? What is working well now that we're in the middle of January?
Well, I think there's some scenarios, and I can tell you where it is working well and what the flaws are with that and how we can make it better. Really, it's kind of like a patchwork type of rollout where there's some situations where we're having very high uptake of the vaccine, excellent delivery to high risk populations, which should be prioritized. And I'm finding that a lot of that depends on the personal responsibility and advocacy of the leaders on the ground, not the planning from the government, which really, should have been the case. So to eliminate that patchwork delivery system in the middle of a pandemic. So to give you an example, I was recently talking to a physician who works in long-term care. And long-term care is a sector where, of course, it's very important to vaccinate as many vulnerable seniors and residents as possible, but it's also important to protect the frontline staff. I mean, these appalling situations where we're hearing about residents going without food and water and really the basic necessities to live happen because they don't have enough staff on the ground. And we're already in the midst of a staffing crisis, which tells us how important it is to make sure that we vaccinate as many frontline health workers in long-term care as we can. But yet, the uptake is quite low in these settings where, I mean, I can tell you anecdotally, I've seen in some homes only 20% of staff are getting vaccinated. And I'm happy to talk about the reasons why. But in the homes that are doing well, it's often like a really good family doctor who is the medical director in that home, who's taken that initiative to have town halls, with the frontline health workers to maybe answer questions and, proactively address vaccine hesitancy. It's that family doctor who actually is literally waking up at 5 every morning to make sure they can vaccinate all the night staff, right? I mean, you'll be surprised. Sometimes these teams just show up and I mean, it seems so simple, but they don't take into account that health workers work shifts. So people are just not there at the moment and they can't get vaccinated even if they wanted to. The other issue is that many people work part-time. So that's another issue where they may just not be on the ground at the moment. And if you don't have paid sick leave and you're worried about, some side effects after the vaccine, such as a sore arm, getting a headache or fever and having to take a couple of days off, well, that may, lead you to be hesitant about actually getting the vaccine because it might be that you might, even if you want to stay home for a couple of days to recover, I mean, you might not be able to afford the bills, right? You might not be able to afford food and rent. And that's something which should not be happened. And immediately we need paid sick leave for all essential workers across the province.
You mentioned healthcare workers who have been slow to receive the vaccine themselves. What are you seeing about why that's happening?
Well, specifically in long-term care, I can tell you that, I mean, we have a workforce that is stretched to the max. I mean, going into COVID-19, to be very honest, long-term care homes were understaffed. People even called it a staffing crisis before the pandemic. Even the Minister of Long-Term Care at that time said that we were in a staffing crisis before the pandemic even started. At the start of the second wave, I heard from unions that reported, for example, for PSWs, that we had 30% less PSWs compared to the first wave. And that's actually shocking, right? Because these are the people that we need to provide the most essential care for the people that depend on it, vulnerable seniors in long-term care. And we're hearing stories that, for example, basic care, such as, giving people regular showers, making sure that they have time to be well hydrated and they're fed well, is being neglected simply because there's not enough staff on the ground. And a reminder that actually, for any type of care, whether it's infection control, whether it's the basic care that I talked about, whether it's getting medications on time, monitoring for pain, I mean, basic human contact and providing emotional support. I mean, you need enough staff to be there on the ground. I'm now hearing at this point in the second wave that, I mean, the burnout rates are over 90%. I mean, people still don't have adequate protections in long-term care where they don't have gowns and gloves. There's a lack of oversight with infection control. And that's left this workforce very vulnerable, feeling very angry and once again burnt out. So, of course, I think step one is to ensure that all those things are not happening and to ensure that we give people paid sick leave, infection control supports, and so on immediately. On the other hand, I think that, I mean, the other picture is here is that 2/3 of the workforce in long-term care homes, the frontline health workers, are racialized women. Many of them are immigrants to Canada. And we know that there's a big history of actually systemic racism that exists with certain communities, specifically when we're talking about racialized communities and low-income communities. So we not only need to give them protections, and we not only need to eliminate all barriers that exist between, between them and getting the vaccine, but we also have to make sure that we provide them with science-based, positive information led by public health that's culturally safe and language specific, right? I mean, I'm hearing from frontline health workers that they're getting information on WhatsApp, right? And at this point where we're in the
Wow.
midst of a pandemic and, the vaccine is perhaps one of the most like critical interventions of our lifetime, right? To save lives and end this pandemic. I mean, there needs to be something more proactive that's led by the government and the authorities.
That is a really startling thing for me to hear, that frontline healthcare workers are getting medical information from WhatsApp. You can really understand why there's confusion and frustration from people without any medical background who are getting their information from WhatsApp or other social media platforms. If even those who are on the front lines with medical knowledge are getting information from WhatsApp or other social media sources. So that's very concerning. Now, on social media, you had mentioned earlier that the successes that you've been seeing have in large part been coming from family doctors or workers on the ground, frontline healthcare workers. We have a question that's come in from Janice, who wonders, what plans are in place for the many of us who live in rural and small town Ontario who do not have a family physician close by? Janice says hers is in Toronto, to administer the vaccine. Janice says, due to my lung diseases, I am not allowed to travel to Toronto. That's a difficult situation for her. What advice could you possibly provide?
Well, I think at this point, we're still finding out information and more details from the province as to what their plan will be. I do hope that we have mobile teams that will be rolling out from corner to corner across the province to make sure that all high risk populations, anyone who's high risk from COVID-19, and I spoke about who that would receive the vaccine and the booster dose, in a timely fashion. So that's something that's of critical importance, and we're still waiting to hear about this. I mean, I can even share that I learned earlier this week that there was sort of an emergency doctor who works in Perth, Ontario, sort of a small rural setting, who is over 60 and still hasn't received the COVID-19 vaccine and has no idea when it's coming to him. right? I mean, there's other settings where community family doctors still are not sure about when they'll receive the COVID-19 vaccine. And this is the time that we actually need to be engaging these people, community family doctors, nurses, nurse practitioners, public health. These are the people who actually roll out vaccines on a mass scale successfully all the time. I mean, they've been doing it with the influenza vaccine, and I don't know why we are not engaging them more to actually lead this effort.
Did we get this wrong right off the bat? Did we follow the wrong philosophy on how to deliver mass vaccinations?
Well, I mean, I hate to sound like sour grapes, but you're asking me about that, Conrad, so I will give you my honest opinion. I've always been concerned about the actual task force, right? The COVID-19 task force, which was formed, the vaccination task force, which was formed back in December. And the issue is, it kind of comes back to these problems we've already spoken about. I mean, we have a retired general who's leading sort of, that task force, and we have an auto parts CEO, we have a tech CEO, and so on. And I know shipping and logistics also matter, but we don't have the people on that task force who should be there. We have no nurses. And that to me makes absolutely no sense. I mean, nurses are actually the people who put these shots in people's arms day in and day out. We don't have public health who actually plans these mass vaccination campaigns. As I kind of mentioned, family doctors and nurse practitioners would be so important, and they're not part of this task force. Also, we need experts who specialize in science communications, right? People who specialize in getting the message out about how the vaccine is safe, giving people accurate information, and that needs to be done proactively. So people have time to process that information, they can think about it, talk to their families, and so on. And that's missing too. So I can once again share success stories. Like I have a colleague who's a scientist at the University of Toronto, a scientist in infectious diseases, who used to work as a PSW in long-term care, who's holding these open Zoom sessions on vaccines and trying to give especially frontline health workers accurate information about what the vaccine is about to increase uptake. And it's a grand success. And these people are heroes, in my opinion, for doing the work they do. But there needs to, I mean, this should have been included in the centralized planning.
We've heard from our audience on social media, and some of them have expressed the same or similar frustration with the makeup of that vaccine advisory panel that you just mentioned. We have a comment from Sarah who's wondering about. She says, "I'm wondering about those of us who are regulated health professionals who work in private practice but provide services to vulnerable populations in residential care homes." She says there has been zero information about how those of us who are not in hospitals will be vaccinated and when. What would you say to Sarah? She's certainly sharing some of the same frustration that you've seen.
Yeah, I mean, I absolutely agree with you, Sarah. I think it's quite inappropriate. At this point, I'll even share with everyone. I mean, literally, I've heard from many of these people who work in the community, uh, family doctors, nurses, nurse practitioners, pharmacists, and also even paramedics, that they're willing to convert this to a 24/7 operation, right? 24/7, 7 days a week, which is what it needs to be, right? When we're having this big surge in the second wave, we're seeing this really scary variant starting to enter into our communities and into our long-term care homes even. I mean, we need to get this rolling as quickly as possible. And I'll even share with you, recently there was a slowdown in the vaccinations on Saturday and Sunday. I mean, that can't be happening. And I don't have the answer as to why this wasn't done from the very beginning. And I don't have the answer as to, when we have so many people willing to volunteer and step up and get these mobile vaccination teams going from the community, why it cannot happen today.
So, if we're going to do a 24/7 vaccine operation, and that's one of the possible solutions to getting more people vaccinated more quickly, what else do we need to do?
Well, I mean, I think it starts with having the appropriate people involved in the planning, right? To ensure that we can engage people who are these community family doctors who are doing such amazing work during this pandemic. I mean, you'll be surprised to hear that even with little resources and not much support, almost all family doctors' offices continue to be open. And these are the people who, once again, should absolutely be prioritized and be included in the vaccine rollout. They're willing to do this, and once again, they are the experts in vaccinations, in my opinion, one of the experts, right? So we need to engage them, and we need to actually move away from hospitals. I'm not against hospitals. I work in a hospital myself, but only focusing on hospitals is a concern for me, right? The other thing I will add is that it's often these frontline community health workers, family doctors, nurses, nurse practitioners, like I've already mentioned, that have relationships with people who are getting the vaccine, right? When I spoke to my colleague who works as a family physician in long term care and is doing some amazing work, the reason that the uptake in that long term care home from frontline health workers was so high, around 80%, was because the staff all know her. They all trust her and they understand where she's coming from and they have that relationship. And let's not forget, I mean, at the end of the day, regardless of what intervention we're trying to use, I mean, healthcare is all about human connection and it's all about relationships. So we need to, I mean, I will re-emphasize it. I cannot say that enough, that we need to get people who are working in the community who can give these vaccines and are the experts. We need to engage with them and increase the speed of our vaccination rollout.
Okay, we've just got a few minutes left, and I want to take the remaining time to talk about the vaccine and your experience with it. Let's start there. We've got a lot of questions from people on social media who want to know things like, what are the side effects? In what situations is it safe to take? And for whom is it not safe? So let's start there. What was your experience with the vaccine like?
Yeah, so I got my first dose on New Year's Eve. Ironically, I mean, mixed feelings. I mean, I do wish, as someone who works in long-term care homes, and honestly, somebody who's seen frontline working in long-term care homes with large-scale COVID-19 outbreaks, that our government and our authorities had done so much more, to protect vulnerable seniors and to protect the staff working there. And at the same time, I was happy because it shows us, when we come together, across, different countries as, one species, sort of say, and we put all our effort into something like the vaccine. I mean, science can triumph and we can develop this vaccine for this virus that really was very new just a year ago. So while I was very happy to get the vaccine and it was a celebratory environment, I really am concerned about long-term care. And I wanted to also say that I'm very hopeful that through all this death and devastation that we've seen in long-term care, like in Ontario, we have over 3,000 deaths in long-term care, well over 10,000 across Canada now. I hope that we'll start to see major systemic change that is required. I mean, I hope we're start to see national standards for long-term care, the end of private for-profit long-term care, or at least a plan as to how to make that happen. And of course, addressing the staffing crisis should be step one in these scenarios.
A couple quick
Yeah.
questions before we go from social media. We have someone who is wondering, is this vaccine safe to take if you're pregnant or trying to become pregnant?
Yeah, so I mean, I'm not an obstetrician or someone who provides medical care to people who are pregnant. So I would defer to experts who work in that setting, family doctors and obstetricians. I'm hearing sort of variable input, and I would encourage you to have a conversation with your physician, directly about that before making a decision.
Last question I'll ask you is around your message to people who, for whatever reason, are skeptical of the medical information coming from people with experience and expertise like yourself around the vaccine and the virus itself. There's a lot of misinformation being shared about the vaccine. What do you say to those who remain skeptical and may not take the vaccine because of it?
Yeah, so I can definitely tell you a few important points that are very crucial when we're thinking about getting this vaccine or not. I mean, first of all, it's an mRNA vaccine, so it doesn't have dead viruses like previous vaccines like influenza. So that likely makes it a lot safer. Secondly, I mean, the effect of the vaccine, like I'm not worried about long-term side effects from this vaccine because that's how vaccines work. I mean, generally, their effect is done in the first few days, and then all that's left is the body's immune response. The third issue is that when we're talking about long-term side effects, those are usually detected by 30 or at most 45 days, and that's really the case with all previous vaccinations. And even the initial trials from Pfizer and Moderna were up to 60 days. So they almost certainly would have detected any issues with the COVID-19 vaccine in those trials. And the fourth point, which is probably the biggest point that we have to consider, is well, what's the risk of not getting the vaccine? And that risk to me is much bigger. It's the risk of getting COVID-19 itself. I mean, we've talked about long-term care and we've talked about seniors where really we could be looking at great suffering and even death, especially in long-term care homes and retirement homes. But even for young and healthy people, there's a serious risk of getting heart and lung complications. I mean, I was looking at data yesterday that actually showed that for people hospitalized with COVID-19, they have a one-third chance of being readmitted to the hospital within about half a year, right? And getting sick, and even a significant chance of getting sick and dying from COVID-19 afterwards. So those are serious risks that we have to take into consideration. And I mean, I think that means that almost all of us, need to get vaccinated as quickly as we can, whenever the vaccine will be available to us.
Dr. Arya, thanks so much for being available to talk about all of this with us today. Part of the reason that we do these live interviews is to make sure that we can get experts with experience and education out to members of the public and have them directly answer the questions that people are asking on social media and in their groups, in their homes, and with their families. So thank you very much for providing the information and sharing your time with us today.
Yeah, thanks so much, Conrad. It's a pleasure.
All right, thanks everyone who participated in the live chat today with questions and comments as well. Thanks in particular to producer Haley Zimek and the amazing team at CBC in Toronto who made this interview happen technically. Thanks for your help. We do one of these live chats every week. If there's someone you want to hear from, let us know. Follow us on Facebook, Twitter, and Instagram at CBC Hamilton. I'm Conrad Colasso. Thanks for watching.